Rabies by Andrea Barnes, Megan Osterloh, Shanti Garcia, and Gunnar Norton. Megan will be presenting the etiology. Gunnar will be presenting reservoir and other information. Andrea will be presenting signs and symptoms, as well as treatment and prevention. And Shanti will be presenting transmission. Etiology. Rabies is classified in the Rhabdoviridae family, which includes the lysovirus, ephemerovirus, and vesiculovirus, which are all genera for animals. The rabies genus is the lysovirus, and the scientific name is just called the rabies virus. Remember that since a virus is not considered living, that's why it has a genus and not a species name. The morphology of the rabies virus, it is bullet-shaped. It has a negative single-strand RNA and a lipoprotein envelope, which has 10 nanometers of spikes around that envelope. As you can see here in this picture.
A reservoir is the long-term host of a pathogen. While all mammals can be infected, not all mammals carry the virus as reservoirs. Known reservoirs are coyotes, raccoons, skunks, foxes, and several species of insectivorous bats. For example, the vampire bat. Skunks are the main reservoirs in the northern and central states, as well as California. Raccoons are mostly in the East Coast, while foxes are in the south, across Texas, New Mexico, and Arizona. In Hawaii, the main reservoir is the mongoose. Hawaii is known as a rabies-free state as they do not allow the transport of any animal into the state without first receiving the 2 rabies vaccines, and they must go through a quarantine period of 120 days to enter. The rabies virus can affect all mammals, but would be extremely rare and difficult to infect a marine mammal. Big game animals such as elk, deer, bear, and moose are still able to be infected as well, but it is very rare. Mostly small animals known as varmint are the main victims.
Signs and symptoms of rabies. The first signs and symptoms of rabies include general weakness, discomfort, fever, headache, other flu-like symptoms, and discomfort or prickling at the site of the bite. These symptoms can last for days. Within a few days of these symptoms, the patient may experience cerebral dysfunction, anxiety, confusion, agitation, and then these signs and symptoms will progress to delirium, abnormal behavior, hallucinations, and insomnia. According to the World Health Organization, there are 2 types of rabies that will result in different symptoms. The first type of rabies is furious rabies and is exactly how it sounds. Patients will exhibit signs of hyperactivity, excitable behavior, hydrophobia, and sometimes aerophobia. This type of rabies usually results in cardiorespiratory arrest, which causes death. The second type of rabies is paralytic rabies, and this is about 30% of all human cases of rabies. It starts with a gradual paralyzation that begins at the site of the bite, or the site of the infection, and is followed by a coma and will eventually result in death. Rabies signs and symptoms usually last for 2 to 10 days and once the signs and symptoms appear, the disease is almost always fatal. There have been very few cases of survival once the signs and symptoms have become apparent.
So now we want to talk about transmission. Transmission occurs from mammal to mammal. Usually it's between an animal to a human being is what we usually see, or an animal to an animal. Humans don't usually spread rabies. It can happen, but it's not very common that it does. We learned that it can go through a bite but I think more commonly than the bite of a human to a human is like getting an organ transplant, and then the rabies gets transferred over to the person who receives the transplant. As we already talked about, there are distinct strands of rabies in raccoons, skunks, foxes, coyotes, and bats. We've already talked about them being reservoirs. And then obviously we are pretty familiar with dogs also being able to carry rabies. So dog bites are very common ways for people to get rabies. It's probably the one of the most common ways. And then bites are the most common way of transmission of rabies. So what happens is the bite breaks the skin, and then that allows the saliva to enter into the body, which then infects the person or animal that was bitten by the animal that was already infected. And then a less common way of transmission, but still does occur, not very often, is spread or transmission through the mucous membrane.
The prevention of rabies. Rabies is usually spread to humans through a bite from a dog. Because of this, the World Health Organization recommends that all dogs are vaccinated for rabies. As you can see on the chart to the left, 99% of human cases result from dog bite. The World Health Organization also recommends that people in high-risk areas or career paths be educated on the behavior that an infected animal may exhibit. Some of the signs that should be looked for in dogs is foaming of the mouth and unusual behavior. People in these areas should know how to respond to these infected animals so the animals can be handled properly and the infection will not spread. The rabies vaccination should be given to anyone that may come in contact with an infected animal. And if someone does come into contact with an infected animal or with an animal that could be infected, they should seek medical attention immediately. The rabies vaccination is an active vaccination, but there is a passive form of vaccination that can be used after someone comes into contact with the disease. This passive form of the vaccination is referred to as the rabies immunoglobulin. This is the treatment of rabies. Anyone that comes into contact with an animal that could be infected should seek immediate medical attention. Medical professionals should follow the post-exposure prophylaxis, or PEP, which is recommended by the World Health Organization. PEP is divided into 3 categories. A Category 1 exposure, which is touching or feeding an infected animal and coming into contact with that animal's saliva. There is no PEP measures for these cases. A Category 2 exposure, which is nibbling of the uncovered skin, minor scratches or abrasions without bleeding. The PEP response measures for these cases is to treat such wounds and get immediate vaccination. The Category 3 exposure would be transdermal bites or scratches, licks on broken skin, contamination of the mucous membrane with saliva from the infected animal, or any contact with a bat. The PEP response to Category 3 exposures is immediate vaccination with the active vaccine, and then follow it with the rabies immunoglobulin. The rabies immunoglobulin is the passive version of the rabies vaccination. And in addition to that, they need to do local treatment of the wound. When they do the rabies PEP measures for Category 3 exposures, they do the rabies immunoglobulin on the day of the exposure, as well as the rabies vaccine on the day of exposure, and then they repeat the rabies vaccination on days 3, 7, and 14.
Before the 1980s, the rabies vaccine was a series of 21 shots. After that, it was reduced to 5 shots, one on the day of the exposure, one on day 3, one on day 7, one on day 14, and one on day 30. There aren't any known animals or humans with an immunity to rabies. However, there was a village in the Peruvian Amazon that showed potential. The village had a bad infestation of vampire bats that had been exposed to rabies. In the village, there were 7 people bitten by the bats that had survived. Of the 7, only 1 had been given a previous rabies vaccine. The other 6 also had rabies antibodies found in their systems. There could have been a lot of factors to this development, but the most likely was that they were exposed to a very, very light amount of rabies in order to develop the antibodies. It does show promise, however, that the human body can adapt to and become immune to rabies.
So we also just wanted to include a few fun facts for everybody to know. Maybe it'll help kind of remember some of these things. But the first one is that rabies was actually named after a Latin word which means rage. And this is because one of the ways you can tell an animal or even a person has rabies is that they're just really crazy and have a lot of rage in them. The second one that we wanted to share was that obviously, as we already talked about, the incubation period, a normal one is from 2 to 10 days, but actually an incubation period could last even longer. It kind of just depends. It's said to even last up to a few years. And then lastly, a lot of the times we think that dogs have rabies most of the time, but in 2010, CDC did a report, and they actually found that cats that year had more rabies than dogs did in the United States. So comparison from cats having 303 cats being reported with rabies, and then only 69 dogs being reported having rabies. So super big difference and kind of shocking.